If you're just joining us, this is the Dr. Anonymous on Blog Talk Radio, and our guest is Erin Breedlove, a pre-medical student from the southeastern part of the United States, and her blog is called Healthy, Unwealthy, and Wise. You can get there by going to healthyunwealthywise.com. And let's kind of change gears here a little bit, and let's talk about social media. And but before that, I did want to ask you. So I guess kind of going back to high school, or even in grade school. So were you always kind of geeky? Were you always kind of interested in electronics and computers and that type of stuff? Did that kind of set the stage for your social media interest?
Absolutely. One of the ways that I improved my fine motor skills that's often sort of a lacking component of CP, if you will, is I learned to type with one hand. But by the time I really learned to type, I was in about the sixth grade, and I found myself typing about 85, 90 words a minute with one hand from.
So how do you utilize Twitter then? I mean, do you use it to, find links? Do you use it to communicate? Do you use it for both? Because everybody uses Twitter differently. I'm just kind of curious on kind of your workflow, or, how you utilize Twitter in your social media life.
I utilize Twitter for anything and everything it'll hand me. I get a lot of course, information from Twitter, but the thing that I thrive on most is dialogue between fellow patients, fellow pre-meds, doctors, really anybody that'll talk, I'll listen. Recently I've made some pretty hefty connections with my tweeting and things like that. I've gotten offers to do some things, and it's I'll use it for whatever it'll hand me. I think that's the goal behind social media, is to accept what it is for what it is. And there's people with goals out there, but if you're goal oriented, you're closed-minded. If you go in with the goal, you may not reach it, and you may get discouraged. So, let it establish your goals for you. So that's always been my philosophy with social media in general. Just see where it goes. Do it, see where it goes. Social media is my leap of faith.
So then, how did you start blogging then? How did that start?
I decided that at first I wanted a resource for parents of children with special needs, chronic illness, that sort of thing. And but I wanted something a little different. I was kind of sick of seeing that whole trend where the only thing that was written were things by medical professionals or things things by other parents and things like that, but they weren't getting a personal perspective. And I think that was very important. But again, I started it out that way and didn't really like where I was going with it, because I felt like I wasn't really necessarily qualified to give advice to parents. It got kind of just borderline. I would call it inappropriate because they were reading my stuff and they were asking me questions and recommendations and things like that, and I often had to back off and remind people that I wasn't a parent. I was just somebody living it, and sort of got out of that, and it's pretty quick.
Yeah, that's usually the first thing that people who blog experience, is that they get asked questions, and it can be intimidating at first, because you put an opinion out there, and people want to engage with you, or people believe that you may have some expert knowledge about this, and it may just be your opinion. And definitely understand maybe backing off and saying, hey, this is just my opinion, and I may not know as much as you think I know, but this is just what I think about whatever topic that you're talking about.
Right. And it's a very hard thing to learn at first. It's a very hard thing to sort of cope with as a social media, as you can probably relate to as a social media hobbyist. But it's, there's a hard balance between, what you offer with social media. I think, I think the whole concept of branding, which I don't even want to get into at this point, but the whole concept of branding is important to an extent, but if you brand too far, you dig yourself too far into a hole that you probably won't get out of.
I might be there now, but that's probably a topic for another show.
Right.
But getting back to your blog, I mean, do you kind of have a vision of what you would like to do with your blog? Would it just be to to share clinical information? Would it just be to share stuff about yourself, or when you do get into medical school, is that something you're going to be continuing to talk about, or you haven't really gotten that far yet?
I've had quite a few physician authors tell me that I should keep chronicling the events through pre-med and then up, through medical school, through residency, things like that as best as possible, and possibly publish the content of my blog. And that was, needless to say, very, very flattering and something that I probably will consider at some point. But for now, that's kind of what I'm writing with the intentions of doing.
Okay.
Because I write on such various topics that I feel like it would sort of craft into an interesting little tale of, first the little baby that could, and then and then all the way up into the doctor who was treating babies that can, that kind of thing.
Mm-hmm.
I think it could sort of craft into an interesting story, but we'll see where that goes 11 years from now.
And I know in just the past few months, you've been kind of experimenting a little bit with live video, the Ustream.tv platform. And how was that experience been for you as far as, live real-time chatting and, interaction with a chat room, and how's that been for you?
Ustream, I like to think of it as Twitter on steroids. If you can tweet and send your tweets out to however many followers you might have, it might be hundreds, it might be 80, it might be however many, you can definitely Ustream. Twitter is just as real time as Ustream might be. Ustream, you just have to, maybe put a little bit of makeup on, adjust your lighting, and go. But I think Ustream is simply an extension of what I love about Twitter, is that real time, deep conversation. And I think it's absolutely my favorite social media platform aside from Twitter right now.
And if people want to check that out, I encourage people to subscribe to your Twitter, because I know based on your coming up class schedule that there's nothing kind of on the schedule, but I know when you have some free time or when you're unwinding from your day, sometimes you just put a tweet out there and say, hey, come and hang out with me for the next half an hour or so on Ustream. And that's one of the great things about Ustream, is that you can just put a tweet out, and then you can have, a dozen people in your chat room just chatting. So I know that if people are curious about hanging out with you on Ustream, it's not anything scheduled, but definitely subscribe to your Twitter feed, and they'll be able to check that out. And something very exciting is that, and I know you've tweeted this out already, is that you've been asked to speak at a conference coming up, I think in the next 6 months or a year. Share with us kind of how that opportunity was presented to you, and what the conference is going to be about, and what you're going to be talking about.
Um, Actually, the conference is biennial, so it happens in May of 2010, which is kind of how I figured I sort of discovered it. So it'll be in May 2012 at Gillette Children's Hospital in St. Paul, Minnesota, and I found out about it because I follow a pediatrician that works with Gillette, and he started tweeting live from this conference. And all I saw was that it was a neurosciences conference. And I absolutely went crazy. I started flooding his inbox with just, what is this? Can you give me more information? This kind of thing. And then he had the coordinator of the conference contact me and, say, here's what it is, here's the information, that sort of thing. I looked it over, emailed her back, and asked her, who presents, who are the people giving the information, and she said, anybody and everybody that wants to. And I said, okay, but what is it? And she told me that, and this is what it is in my head as well. It's a pediatric neurosciences conference for healthcare professionals who work with children with disabilities. It's all about advancement, all about different treatment options, all about that sort of thing. It's sort of a, hey, let's get together and share what we know. And so I sort of backed off for a little bit and then contacted this pediatrician again and said, what do you think, about maybe getting together on a proposal? I thought that I was going to go in, on a panel or something. Well, then he turned around like 2 days later and said, no, we want you to present by yourself.
Wow.
You can imagine my face looking at the computer screen. And it was, I sort of read the email, called him and said, I think the first thing that come out of my mouth was, are you insane? And of course he said no. But and then we started brainstorming for a couple of weeks on what I would present on, because if it's doctors presenting to doctors, I'm nowhere near a doctor yet. And we started thinking about how I could tie my personal perspective in with my study of medicine to present something that any healthcare professional could learn from. And the topic of the presentation will be transition care and how, things like when all of a sudden pediatric patients are transferred out to, internal medicine type specialties, all of a sudden kids are thrust into college unprepared with disabilities and things like that. So how do we do that? What is the medical professional's role in that transition, and what are the studies finding that's easier for people such as myself to transition into older, higher standards of living. So it's going to be an interesting time for sure.